I'm Dr. Ryan Sullivan, and I'm a board-certified allergist and the medical director at Allergy Services of America. I, along with Dr. Abdul Ibrahim, are part of the clinical oversight team. We ensure that the allergy testing and allergy treatment that you're receiving in your clinic are safe and effective. So what is an allergy? An allergy is an immune response that your body generates to a benign substance that it thinks is harmful. So commonly, patients will develop an immune response to dust or pollen or cat dander. Their immune system thinks it's a harmful substance that needs to be attacked, when in reality it's a benign substance that needs to be left alone. But because the body views it and sees it as a threat, it generates this immune response just like it would to a bacteria or virus. And so a lot of people who deal with chronic allergies feel sick all the time because their body's constantly generating an immune response to these benign particles that they're exposed to every day. So what are common symptoms of allergies? Frequently, people with allergies will suffer from sneezing, runny nose, nasal congestion, itchy, watery eyes, ear fullness, ear popping, sore throat, chronic sinus pressure, frequent sinus infections, even fatigue and trouble sleeping. And then if the allergies progress into the chest, a lot of patients will develop cough, wheezing, and shortness of breath. So there are several different ways to test for allergies. The first method is called skin testing. And this is a device that looks like a little plastic toothpick that we place on the skin and kind of rock back and forth. And basically what it does, it leaves a little drop of antigen, things like pollen, cat dander, dust, mold. It leaves a little drop of that on your skin, and we leave it on there for 15 minutes. After 15 minutes, we wipe it off and we see if there's a reaction on the skin. If there is a reaction, that indicates that there's a sensitivity or allergy to that particular antigen. That's the most common way allergy testing is performed, but we can also perform blood testing or RAS testing, and that's where we measure antibodies in your blood to the different antigens like dander, pollen, mold, and dust. There are several different things that we can test you for. We can test to environmental antigens, things like pollen, cat and dog dander, dust, and mold. We can also test for food allergies. Most of the foods that you encounter in a standard American diet can be tested for. We also do what's called patch testing. That's a form of allergy testing where we test to see if you're allergic to common chemicals that are in soaps, shampoos, cosmetics. Oftentimes, people will develop allergies to these preservatives or ingredients in common products, and so we can test for that with patch testing. We can also do an allergy test to penicillin. Many people have a penicillin allergy or think they have a penicillin allergy, and we can verify that with testing to penicillin. So who can be allergy tested? Well, we test babies as young as 6 months of age, and we test all the way to the end of life and everywhere in between. So if you're between 6 months of age and death, you can be allergy tested. What are the treatment options for allergy? Well, there are two forms of treatments that are potential cures for allergy. The first one, the one that everybody's heard of, is allergy shots. Allergy shots are a desensitization to the things that you're allergic to. We give you in injection form very small quantities of the things you're allergic to, like pollen or cat dander, and we gradually build up the dose over time so that your body develops an immunity to those things that you're allergic to. Another way of doing that is through allergy drops. It works the same way as allergy shots, but instead of getting injections, you're putting the antigen in liquid form under the tongue by drops. Now, allergy shots are done in the clinic, and usually they're done on a weekly to monthly basis. Allergy drops can be done at home and are done daily, but both are desensitization programs. Both build your immunity to the things that you're allergic to. so that potentially one day you're no longer allergic to these substances and you can live in your environment without all the problematic symptoms that cause you to suffer and be miserable. Here at Allergy Services of America, safety is our #1 concern. So I'm a board certified allergist and I have my own clinic where I treat allergy patients. My goal as the medical director for Allergy Services of America is to ensure that the testing and treatment that you receive in the clinic that you're located is the exact same that my patients receive in my clinic. So our procedures and protocols that we have developed are the same procedures and protocols that you would receive at a board certified allergist office. The technician who will be taking care of you in your clinic receives the same training that my nurses in my clinic receive. We have a clinical oversight director who's available every day for our technicians and nurses to refer to if they have any questions, concerns, or if they just need guidance on anything that's occurred there in the clinic. Because of the procedures and protocols that we have established, our safety record is second to none. Our incidence of systemic reactions in our allergy shot clinic is lower than the national average and lower than the average in board certified allergy offices. We take safety very seriously, and it is our #1 priority to ensure that you feel safe, comfortable, and confident in the treatment and care that you receive in our clinics.